Do you feel that your breasts are too small? Is one breast larger than the other? Did you lose your breasts during a mastectomy? If so, you might benefit from breast augmentation surgery. Breast augmentation enhances the size and shape of your breasts. New techniques and implants have been developed and adopted that make the procedure safer and more effective than ever. Good candidates for breast augmentation. Before considering which type of breast surgery is right for you, you must consider whether you are a good candidate for breast surgery. Patients should be free of any active infections, have underlying medical conditions such as diabetes, high blood pressure, asthma, or heart disease under control. Be non-smokers preferably. How is breast augmentation performed? Typically, breast enhancement can be performed in a hospital, a freestanding surgical clinic, or a surgical suite in your breast augmentation specialist's office. Usually, you'll arrive in the morning and go home later that same day. Breast augmentation takes up to 4 hours to perform, depending on the technique used, how much reshaping of the natural breast tissue is needed, and other factors. Unless there is no breast tissue, such as after a mastectomy, the implant is almost always placed beneath the natural breast. In a subglandular placement, the implant is placed under the breast tissue and above the muscles of the chest wall. This most closely resembles normal breast tissue. In a partial submuscular placement, the implant is placed under the breast tissue and partially under the pectoral and other chest muscles. In a complete submuscular placement, the implant is placed completely under the muscles and connective tissue. Incisions can be made in the navel, around the nipple, or in the crease under the breast. Breast augmentation risks. Breast enhancement is a very safe procedure, but there are some risks, including bruising, implant rupture, scarring. Frequently asked questions. Can implants help lift sagging breasts? Implants will help your breasts appear less saggy by filling some of the slack in the loosened skin, which increases the volume. For moderate or severe sag, however, a breast lift is usually a better option. Ask your surgeon for their opinion on the best procedure for you. Will my implants feel like natural breasts? The more natural tissue you have before the surgery, the greater the chance that your breasts will feel natural afterwards. Will I have stretch marks after my breast augmentation? Some individuals never develop stretch marks, while others are prone to them. It depends on the extent of the procedure and how much augmentation is needed. Is there much pain associated with breast augmentation? Breast augmentation pain is dependent upon implant placement and incision placement. Your surgeon will prescribe pain medication for you. You'll have more pain if you don't follow your surgeon's instructions or by overexerting yourself during recovery. How long can I expect my implants to last? Implants last from 15 to 20 years. How long should I wait after surgery before exercising? Surgeons advise waiting at least 2 weeks before exercising. How much does breast augmentation cost? Breast augmentation costs between $4,000 and $10,000, depending on the type of procedure. Breast augmentation is an effective way to enhance your figure or to replace breasts that were removed in a mastectomy. Ask your surgeon if augmentation is your best option. A plastic surgery specialist might recommend a different solution, like a breast lift. Different forms of breast surgery can be used to correct different problems.